Hello, I'm Mike Danielson. Today I'm visiting the Center for Nutritional Research at the Illinois Institute for Technology. I'm going to be speaking with Dr. Britt Burton-Freeman. She's one of the leading researchers in the area of pre-hypertension and hypertension research. Today we're going to be discussing her third human clinical trial utilizing a compound called MegaNatural-BP Grape Seed Extract. Let's go inside and learn more. Great to meet you, Dr. Britt.
Nice to meet you.
Now, for those of us who aren't from Chicago and aren't familiar with the Institute, can you tell us a little bit about the work that you're doing here and how this new department got started?
Sure. Well, we started about 6 years ago, and we have the Center for Nutrition Research, which is under the umbrella of the Institute for Food Safety and Health. So we work both on food safety and health aspects of food. At the center that we're located today, this is where we do all of our human research. We also have another location where all of our biochemistry and cell culture work is conducted.
Excellent, excellent. So, Dr. Britt, how long have you been doing this kind of blood pressure research?
We've been doing the high blood pressure research here at the Center for Nutrition Research for 5 years, but we've been doing research with my colleagues, Dr. Tisa Capagoda and Dr. Indica Edisering at the University of California, Davis for many more years before that.
Excellent. So with an estimated 30% of the American population being pre-hypertensive or having hypertension, what is the significance of this research, do you think?
Well, I think pre-hypertension is that period before individuals would go on medication to manage high blood pressure. And so this type of research allows us to utilize alternatives. So you probably heard about yoga, meditation, there's dietary supplements. Well, this is a dietary supplement that you can put into a beverage. So you can drink it as part of your normal diet. So it integrates into normal lifestyle more naturally.
Yeah, and I think that's a huge issue just with, I think most people when they hear, hey, you're pre-hypertensive, you need to make some lifestyle changes, they all leave the physician's office with great intention, but then the compliance of diet and lifestyle changes are so difficult. So this beverage, does it taste good? Is it something that's convenient?
Oh yeah, it's very convenient. We'll have an opportunity to take a look at it in a little bit, but it's low calorie, good tasting, has a fruit flavor to it. The grape seed extract itself has a little bit of a bitter flavor, and so that's just, that doesn't come through in the beverage formulation. It's a real nice beverage.
So it could be as simple as drinking a different juice every morning for breakfast and having a positive impact on your blood pressure. Could you walk us through the research that you've been conducting on this unique form of patented grapeseed extract?
Sure. Well, this particular study, we recruited pre-hypertensive individuals. So these are the people that have blood pressure in that range that's a flag that we better start paying attention so that we don't get into that hypertensive range. And this was a 6-week study that people consumed the beverage twice a day, and they consumed it every day in the morning and then in the evening. But not everybody had the beverage with the grapeseed extract in it. So some individuals had what we call the placebo. So that's the inactive juice compared to the active juice, which had the grapeseed extract. And so after 6 weeks, we measured their blood pressure being on the placebo or the active drink. And of course, we did that beforehand. So it's before and after. And what's unique about this study, which I think is really kind of hits home that the answer of the blood pressure lowering effect of the grapeseed extract, is that after 6 weeks, the blood pressure dropped to a normal level for a majority of the individuals. But then after 4 weeks, people went home and they didn't drink any of the beverages and came back and we measured their blood pressure again and it went right back up.
So it's safe to say that you'd have to take this daily to have the maximum benefit. But that benefit was realized in just over a month.
Yeah, that's right. That's right. And we've had other studies that have been conducted in metabolic syndrome individuals, and 4 weeks there was a robust effect.
The first question I think everybody has, can I eat more grapes? Can I simply drink grape juice? Are all grapeseed extracts the same? What makes MegaNatural-BP different than I guess any run-of-the-mill grapeseed extract? Right.
Well, the MegaNatural-BP it comes from a patented technology. So there's a manufacturing process that is different than other grapeseed extracts. And when you do look in the literature, you'll see that not all grapeseed extracts perform like the MegaNatural-BP. So it's really this patented technology and the form in which it's presented that gives it its extra benefit.
And I would suspect as a researcher, having that consistency through this patented process assures that dose to dose, you're getting the exact same material. Is that something that is critical to you when looking at a research study?
Absolutely, absolutely. We're looking for composition, and we want to make sure that it's compositionally sound, that it's standardized, and absolutely.
Makes sense. Excellent. I know personally compliance to a new diet or nutritional program is difficult. I can only imagine in a clinical trial getting those patients to follow, the daily regimen, the program is really difficult. How important or how valuable was it to have a beverage versus a pill or another form of grapeseed extract to consume?
Yeah, I mean, you're spot on. People do have a hard time complying to new regimens, and in this particular trial, we had about 90% compliance, and so typically we were looking for 80% or better compliance, and so people did a good job with the beverage.
So you recently presented your third human clinical trial on MegaNatural-BP Grape Seed Extract at the Experimental Biology Conference in Boston. What were some of the comments after your presentation from your colleagues and industry that attended?
We presented at Experimental Biology, and I also recently had the opportunity to present some of the findings at the American Aging Association. And some of the questions at both society meetings were similar to the questions that you've been asking. Tell me a little bit more about the composition. Is it available today? And so of course it is available today. We had questions around mechanism of action, what sort of studies have supported the clinical trial findings.
Did you find these are typically clinicians who are saying, hey, is this available now, or was it fellow researchers wondering, hey, is this material available in the market?
Both meetings tend to attract more research scientists than clinicians, and so I'm not sure who the individuals were asking, but I suspect they're more scientists.
Yeah, well, that's great to have that level of interest. When consumers and clinicians hear about your research findings, they're going to get excited. Is this, what is the significance of this to them right now? Can they apply this immediately, or is this type of, does more research need to be conducted?
We have 3 great clinical trials that are showing consistent findings. It's a safe product. It has GRAS status. It is available in the dietary supplement stores today. The beverage is not available yet, so we're hoping that will be available soon, because it just makes an easier entry into people's homes. I think the big piece for the excitement is it's another way to keep people off medication as long as possible. I mean, people don't want to be on medications. Physicians aren't looking to put people on quickly. So what are some of the alternatives? And this just adds to that toolbox of alternatives.
Excellent. We hear about grapeseed extract. Most people, when they hear about a new dietary ingredient, they think, well, can I just get this from food? How about if I just consume more grapes, or eat the seeds with the grapes, or drink grape juice? Will I get the same benefit that you found in the study?
Right, that's a great question, and we do get that quite a bit. There's a couple different things that play into this. One, the composition of the grape seed extract is different than the composition of the grape. The grape, you'd have to eat a lot of grapes to get the same amount of the polyphenols that you're getting. And again, you're not going to get the exact same type of polyphenols in the grape that you get in the grape seed extract. There have been some studies that have shown that grapes can elicit a blood pressure lowering effect, but you get a much more robust effect with the grapeseed extract.
I would suspect you're not getting all the fruit sugars and other calories and that at the same time, which may be an issue for somebody that is dealing with metabolic syndrome or weight issues and things of that nature.
Yes, absolutely.
Wonderful, wonderful. What is the difference between pre-hypertension and hypertension?
Well, when we look at hypertension and pre-hypertension and normal blood pressure, we're looking at ranges. And so pre-hypertension is, if we're looking at systolic and diastolic blood pressure, we're looking at a systolic of 120 to 139 millimeters of mercury, or a diastolic blood pressure of 80 to 89 millimeters of mercury. So you can qualify on either one. And again, it's this red flag range that blood pressure is creeping up. We're not into that risk. We got to do something absolutely right now, whether it's diet, lifestyle, medication. But it's the flag range that we really want to make some changes, and that's where the dietary intervention really comes in strong.
How often should we have our blood pressure checked, do you think?
Well, a lot of people have their blood pressure checked once a year if they go see their physician once a year. So it's always a good idea, particularly as we age, that we keep a good eye on our blood pressure, because it does increase with age. And so as you get closer and closer to those higher ranges, you'll be wanting to take it more often.
And I've heard this analogy that your arteries and blood vessels, as you age, they start hardening. It's kind of like a garden hose that may get hardened, and it loses that flexibility, and the pressure goes up. In understanding the mechanism of action here, does that shed any light on how the grapeseed may affect the vascular system and the flexibility, or is that way too advanced?
No. In fact, some of the work done by Dr. Indika Edisering in cell culture and some ex vivo models have shown very nicely that it's this nitric oxide dependent relaxation of the vessel. There's some cells we call the endothelium, the endothelial cells, and with nitric oxide release that is stimulated by the polyphenols in the grapeseed extract, the vessels nicely relax.